Hi, I'm Doug Blacklidge with the American Health Network Foot and Ankle Group, and since you're viewing this video, I assume you have some interest in our Foot and Ankle Fellowship Program. So I'd like to start out by giving a little background to our group and why we formed a fellowship program, and I think the key reasons why our fellowship program is appealing. To start out, our group started with me. I joined American Health Network in 1997, which at the time was primarily a family practice group, and it's now become multi-specialty, and my group has evolved, and we now have 8 of us plus our fellowship program. Not long after I joined American Health Network, we brought on my friend Mike Miller, who he and I happen to have been friends since about 6th grade, so it's been kind of fun for us to develop our group and develop our fellowship program. I guess to start out about our group, when we first started this goal of developing our specialty within American Health Network, we wanted to bring on people that were academically strong and of a variety of different backgrounds and different residency programs, and I think we've done a really good job of it. We have, most of us are trained at well-respected institutions, and we've had a lot of different fellowship training experiences. Several of us have done AO fellowships, and we've had some people get extra training in external fixators and external fixation. And one of our partners is also primarily interested in wound care. And so there's a diverse mix that's provided through our group, and a fellow can certainly learn from each of us. So I guess first of all about me, I did a residency program at the Detroit Medical Center and was there from 1992 to 1995, and I feel like I got a pretty good diverse background at the time. At the conclusion of my residency, I did a fellowship in Mainz, Germany with an AO trauma hospital, and been able to incorporate some of the principles that I learned there into my foot and ankle practice. Since joining American Health Network in 1997, my practice has evolved to the point where I do a large percentage of revision surgery and the more complex reconstructive procedures, and that's what I really enjoy. I think this adds a lot to our fellow in that you get to see some of the less common things and a variety of approaches to solving problems for our patients. The diversity of our group fortunately offers some partners, again, like Dr. Winters, who primarily does wound care and limb salvage type things. Dr. Perler, who has interest in external fixation and total ankles, as well as myself. And most of us are primarily focused on foot and ankle reconstructive procedures, and that's where we really offer a large volume of a variety of cases. We developed a fellowship starting in 2002, and our very first fellow was a trauma surgeon from Austria, and he wanted to learn foot and ankle procedures, so he came and spent some time with us, and we really enjoyed having him travel around to different offices and different surgical facilities working with us, and I think it was a good first try at having a fellow and having the share of information and the academic exchange. Since him, we started a yearly fellowship program. I believe that started in 2004, so we've had a one-year fellow ever since then, and they've each come from a variety of places across the country, different residency programs, and they bring to us some of the concepts that they learned in their residency program, and we get to share some of the concepts that we've developed over the course of our practices and our training experience. As I mentioned earlier, we all in our group have trained in a variety of places, from the Detroit area to Chicago to Florida, and some of us got more trauma exposure than others, and some of us got more reconstruction training than others, but ultimately I think it provides a good diverse mix. And part of the fellowship program is we get together once a month for academic exchange of presenting cases and presenting ideas or procedures or approaches to challenging cases, and I think we all really enjoy the academic environment, and that's partly why we continue to do the fellowship program. So what does a fellow get out of our program? I think they truly benefit from a variety of attendings with a variety of ideas on how to solve problems for our patients. And we always use the saying, well, it's like putting more tools in your toolbox. If you have a toolbox that's full of tools that you can use if this situation comes up where you need to rely on a trick or a pearl or a certain technique to solve a problem, you'll hopefully have seen it in your fellowship program. I would say that the fellowship program for most of us is a 10-year head start in practice, assuming that you go out of residency and you go directly into practice, and then you got to figure out all this stuff on your own, because residency provides you a foundation. Fellowship provides you a huge head start into how you're actually going to practice and take care of patients. And as I said, I'm really proud of the group that we have, and I'm proud of the fellows that we've trained. And I truly think that spending a year doing the fellowship program is very beneficial, and I think most of us, given the opportunity, would have loved to have done something like this. Actually, two of our partners have, because they're previous fellows. If you have any further interest, please feel free to get in contact with either our current fellow or Dr. Mike Miller, who's our current fellowship director.